All right, let's jump right in. Today, we're going to talk about something that's changing incredibly fast, the modern medical toolkit for treating obesity. It's a topic that's evolving at a wild pace, so let's get straight to what the latest science and procedures really look like. So, why is this such a big deal? Well, let's start with the sheer scale of it. We're talking about 650 million adults across the globe. This is not a small, niche issue. It's a massive, shared health challenge, and medicine is now tackling it in some truly revolutionary ways. And here's something really important to get right from the start. We have to frame this correctly. This isn't about willpower or just a lifestyle choice. The World Health Organization is super clear on this. Obesity is a complex, chronic illness that has reached pandemic proportions. That medical perspective is the key to understanding all the treatments we're about to dive into. Okay, so we've all heard eat less, move more, right? And that's the foundation, for sure. But for so many people, it's just not enough. So what happens then? What does the full spectrum of modern medical treatment actually look like when you go beyond the basics? Here's our game plan. First, we'll hit the new wave of medications that everyone's talking about. Then we'll check out some really interesting middle ground options called endoscopic procedures. After that, we'll get into the most powerful tool in the box, surgery. And finally, we'll tie it all together and talk about how a doctor and patient craft the right plan. All right, first up, the new wave of medications. Let's kick things off with the stuff you've probably been seeing in the headlines lately. We're talking about pharmacotherapy, a whole new generation of drugs that are changing the game. So, what's the big breakthrough here? It's all about hormones. See, these new drugs are incredibly smart. They're nothing like the old-school appetite suppressants of the past. Instead, they work by mimicking the signals your own body uses to tell your brain, hey, you're full. Right, so how does this hormone mimicry actually work? Well, think about drugs like Wegovy and Mounjaro. What they're doing is essentially hacking your body's own system for feeling full. Wegovy copies one key hormone called GLP-1. Mounjaro is even more advanced. It copies two of them, GLP-1 and GIP. The bottom line is the same, though. Your brain gets a really powerful signal that says, I'm satisfied, and you just naturally eat less. And does it work? Oh, yeah. Just look at these results from a head-to-head trial. Wegovy, the single hormone drug, got people to an average of almost 14% body weight loss. That's already impressive. But then you have Mounjaro, the dual hormone one, pushing that average all the way past 20%. I mean, that is a massive jump in effectiveness. It just shows you how powerful this approach really is. But of course, there's no magic bullet. There's always a flip side, right? Since these drugs work on your gut, it makes sense that the most common side effects are, well, gut-related. We're talking about things like nausea, constipation, you see them here. And yeah, a high percentage of people experience these. For most, they're manageable, but for some, they can absolutely be a deal breaker. Okay, so that's medication. Now let's move on to the next step up the ladder, a really fascinating middle ground that sits right between pills and full-blown surgery. We're talking about endoscopic options. You can think of this category as kind of like surgery light. Instead of making big cuts, doctors use a flexible tube, an endoscope, that goes right down your throat. This lets them work inside the stomach without any major incisions. That means it's less invasive, lower risk, and, this is a big one, a lot of these procedures are totally reversible. And there's a whole toolkit here. You've got intragastric balloons, which are basically temporary space fillers to help you feel full, giving you around 7 to 15% weight loss. Then there's endoscopic sleeve gastroplasty, or ESG, where a doctor actually uses stitches to make the stomach smaller from the inside. A bit more effective, but it definitely needs a skilled hand. And then you have aspiration therapy, which lets a person drain about 30% of their calories after a meal. It gets the biggest results in this group, but as you can imagine, it takes a ton of commitment from the patient. So you can see, each one has its own unique pros and cons. Let's zoom in on one of the coolest innovations here, a balloon you just swallow. It's wild. Here's how it works. You swallow a little capsule that's attached to a tiny tube. A doctor then fills the balloon up, pulls the tube out, and that's it. The balloon just stays in your stomach for about 4 months, helping you feel full. Then it deflates all by itself and just passes through your system naturally. No surgery, no removal procedure. Pretty amazing. Okay, so now we're moving to the heavy hitter, the most powerful and permanent option in the toolkit, bariatric surgery. This is for when other methods just haven't been enough.
And let's be really clear about this. The research is overwhelming. Right now, bariatric surgery is the single most effective way to achieve major and, just as importantly, long-lasting weight loss.
Now let's look at the two big players here. On one hand, you have the Roux-en-Y gastric bypass. This one gives you the absolute biggest weight loss and the best chance of putting type 2 diabetes into remission. But, and it's a big but, it comes with a higher risk of complications down the road. On the other hand, you have the sleeve gastrectomy. It's still incredibly effective, but its biggest selling point is a significantly lower risk profile. So it's that classic medical dilemma, right? You're constantly weighing maximum power against maximum safety. So we've got these powerful drugs, these clever endoscopic devices, and major surgery. So how on earth does anyone choose? That brings us to our final and maybe most important section, making the right plan. You know, if there's one thing to take away from all of this, it's that there is no one-size-fits-all answer. There just isn't. Finding the right treatment is a deeply personal journey. It's a conversation between you and your doctor, weighing your own health, what your goals are, and what level of risk you're comfortable with. It's about collaboration, not just a prescription pad. And this quote from a major surgical study just hits the nail on the head. It says we have to look at both efficacy and safety and think about the individual patient, not just chase the biggest weight loss number. It's about treating the whole person. And that really leaves us with a big question to chew on. As all these incredible tools, from simple injections to complex surgeries, become more and more common, how do we make sure the conversation stays focused on what really matters, on overall health and well-being, not just a number on a scale? It's something we're all going to have to think about as this medical revolution unfolds. Thanks for watching.